and welcome to episode 109 of the Let's Talk Thyroid podcast. I'm your host, Annabelle Bateman. Today I am talking with Dr. David Cowhig. Now, I get the privilege of speaking to people from all over the world on this podcast, but on today's show, I am talking to a man who lives and works in the same suburb within Brisbane as I do. So that's a pretty small world to have one of the very few Australian holistic dentists in my own suburb. So I'm looking forward to introducing you to David. Let me tell you a little bit about him first. He's actually trained as a regular orthodox dentist in the UK. He came to Australia in the late 1990s, did some training with ACNEM, which you probably will have. If you've listened to a few different episodes, you'll know that a few of my guests, including my own doctor, has done various training with ACNEM. It's the Australian College of Nutritional and Environmental Medicine. A good maybe not test, but a good screening actually, if you're looking for a functional medicine doctor or someone needs to look whether they've done training through ACNEM. They seem to be the place to go in Australia for this sort of holistic training. So for the last couple of decades, David's incorporated those new modalities into his regular medical dental practice. He really is a leader in this whole emerging field of holistic dentistry. We talk a little bit about that at the beginning of the conversation. So if you are looking for a holistic dentist, and by the end of this conversation you probably will be, you want to check out Dental Wellness in The Gap in Brisbane and the Dental Wellness social media and podcast as well. So enjoy this conversation with Dr. David Cowhig. I hope you find it really interesting to make the connections, perhaps for the first time, between some of your symptoms and dental health and some of the really practical things that you can do about it. Don't forget at the end to stick around. I'll ask a couple of questions to help you process the conversation and take action on it. All right. Well, welcome Dr. David Cowhig to the Let's Talk Thyroid podcast, all the way from the same suburb that I live in Brisbane, Australia. You haven't come very far, but it's really nice to have you here.
That's great. I mean, we bumped into each other in the Gap shopping centre, I think maybe even 18 months ago. And you mentioned it and I said, yeah, I'd be interested. But then things got away from us. But it's good to get together now.
Yeah, that's right. Exactly. Well, I think we first met a few years ago through a business networking thing. And I just couldn't believe there was someone else interested in natural health that was in the Gap. And, we had I remember we had a really interesting conversation. And so when I started the podcast, I thought, that I'd never really thought before, probably that conversation about oral dental health and having any connection in with Hashimoto's or thyroid conditions. So I thought when I started the podcast, I thought, right, I have to get David on. And so now's obviously the right time. So it's good.
Yeah.
So you are a holistic dentist. What is that? Like, what does that mean?
Look, I mean, I would call myself a holistic dentist for the last 25 years, actually, since I've been in Australia. I qualified 35 years ago, but when I came to Australia, I got the opportunity of doing a fellowship in nutritional and environmental medicine with a group called ACNEM. And I was actually buying a practice and setting it up at the same time. So I just combined the two things, which basically showed how the things in the mouth have an effect on the body and how the health of the body has an effect on the mouth as well. So, I mean, it's as simple as that. Once you start appreciating that the mouth is the pathway of obviously our digestion, our first stage of our digestion, our respiratory system is connected to it. Our sinuses, our nasal passages. So it's all connected. And then the gut is obviously the next part that it's the top of the gut. And what happens in here has a massive impact on gut health, which then can have a massive impact on whole body health, on the whole systemic health, cardiovascular health, diabetes, thyroid function, adrenals. It's all connected. And I think the more I accumulated different knowledge in the sphere of the natural health industry as well, it just became clearer and clearer how important the oral health is. unfortunately, general dentistry tends to compartmentalize the mouth, um, and leaves other things to other people. I tend to try and work all together with all different modalities so that we can look after our patients, really, so that they can eat the foods they should be eating without pain, without sensitivity, um, getting being happy with how their teeth are, their gum health's in good shape, they don't have infections in their mouth, and they sleep well, they breathe well, and generally they're moving towards wellness.
Yeah. Yeah. That's our whole medical system, though, isn't it? We're all so compartmentalized. If you've got a
Yeah,
heart problem, you see a cardiologist. If you've got a mouth problem, you see a dentist. If you've got a leg problem, you see an orthopedic surgeon. And so that's what I like about this whole holistic health is, well, we're actually a whole body, aren't we? You know, we are, funny enough, we're
yeah,
actually a whole integrated body.
yeah,
And so,
absolutely.
so are there many holistic dentists around, David?
Look, when I think back to the 25 years ago I did that fellowship, and then I think there were about 10 or 15 dentists in Australia doing the same thing.
Mm-hmm.
And then it wasn't really pushed after that. So there's been 2 decades
Wow.
where dentists haven't really been exposed to these concepts,
Mm-hmm.
and the main medical and dental fraternity have continued training their traditional modalities. So it has become a challenge to find dentists who have a broad knowledge on these aspects. The word holistic is being passed around. There's a lot of practices that might say they have a holistic philosophy,
Mm-hmm.
um, which is great, and that we all should have a holistic philosophy. But there's a lot of patients who are very well informed and very they're looking for somebody who takes their whole body health into account, and then that's when it's sometimes a struggle when when the knowledge isn't there. Really, it's just about um, maybe removing amalgams, or but there's a whole process in that as well, and well, hopefully we'll talk about that sometime
Mm.
today.
Yep.
um, so there are very few of us in America. uh, I believe that the oral systemic health industry is the biggest, fastest growing industry in the wellness industry.
Wow.
And yet, I came from England. I trained at King's in London, and London is still, there's very few. Australia, there's very few. So, which I don't mind, but it's I suppose it's my turn to try and pass on some of the knowledge to other people and see if they're open minded to it. Really,
Mm. So when you're talking with other I assume at some point you talk with other
yeah.
dentists or go to conferences and things, and are they interested?
The
That's probably a bit of a
younger
big
the
question.
younger dentists often uh, the female dentists are more interested,
Hmm.
um, more because they. I mean, dentistry is a great profession for a woman because you can work part time, you can have a family and still coordinate things. So it's
Mm.
but there are certain aspects and exposures that general dentists become exposed to that they want to try and protect themselves from. So I think that's one of the conversations of protecting yourself as a practitioner. We go into our job and no one really tells us that we're at risk of being exposed to anything that could cause harm to us as well. So,
Mm.
so that's one of the conversations. But then when you start talking about issues with mercury and fluoride, and then the shutters seem to shut down because the conditioning and the training has basically promoted that as the gold standard. So
Mm.
that's how it is, really.
Yeah.
Um, so it takes somebody who maybe has had some medical issue, or then they're more interested in saying, well, there must be another way, and there is another way. And if you look online, there's plenty of American and European dentists going this way.
Yeah. Well, that seems to be the case even with your medical doctors, is that it's ones that that have had their own health issue that seem to then go, oh, well, the mainstream medical way of dealing with thyroid health, take the pill, don't worry about anything else, hasn't worked for me. Maybe there is something else. And so that's been my observation, is that a number of the doctors that are in the thyroid space have got there because they've got their own condition, and what they were trained to, the way they were trained to treat patients and therefore treated themselves, just didn't, well, it certainly wasn't the whole solution. So I
Yeah,
guess
yeah,
that's what you're saying. It's the same thing in the dentistry field.
it is, and it's and all dentists have. Our aim is to try and save teeth and optimize oral health. That's what every dentist is trained to do and encouraged to do. But then certain things come in the way, and you either go with the flow, or you start questioning it, and all of a sudden finding another way. That's true.
Yeah. Welcome to life.
Yeah.
Yeah, that's right. I think have you got birds in your background?
Look, the doors are open and there's birds. Well,
Yeah.
the garden, are they too noisy?
No,
I'll tell them to
it's
turn
fine.
off.
You tell them to be quiet. I often say, people who listen to this podcast say, I can hear your birds. I can't hear birds at my end. But see, it's because we live in the same suburb. We've got birds
Yeah,
everywhere here in Queensland.
yeah.
But people say, no, I really like it. I like, they can, even when I can't hear it, they can hear it. So it's spring here in Australia for those listening from around the world. It's spring. And so the birds are out, the sun is out. It's beautiful weather. So David, in terms of thyroid health and oral health, like, what are the connections? What do you, how do you see the connections in between thyroid health and oral health? Like, what? Yeah.
Look, I have a lot of patients who have either had thyroid issues, or they're dealing with thyroid issues, and there's a lot of similarities in all of them. In the fact that obviously they're mainly female,
Mm-hmm.
and they've had stress in their lives. And when we look in the mouth, we see that they're often very prone to tooth decay. But in tooth decay in areas that are really quite unusual, they're more like on the inside of the neck of the teeth, where the tongue is, or on the outside of the neck of the teeth. Now, and gum health obviously is another issue that not particularly prone to, but they're more reactive, so they're more prone to inflammation. The other aspects are really their sleep and their ability to sleep well. Often adrenal stress plays off thyroid stress, and if you're not sleeping well and you're not breathing well, then you're going to turn into almost a short, non-restful, possibly mouth breathing, which then has a detrimental effect on the mouth as well, makes you more prone to gum disease, more prone to tooth decay, more prone to stress and getting into that fight or fright stress mode, which then everything is working too hard and obviously stressing your thyroid, stressing adrenals, and it's all playing off each other. So my role in all of my patients is, first of all, looking at their saliva quality and looking at the pH of the saliva. So I'm looking at the more acidic the saliva is, the more risk that the nasty bacteria that cause gum problems and tooth decay are going to propagate. So looking at that, looking at their airway and the ability to breathe through their nose, which is a big factor. And that often their bite they've had their bite changed by maybe having braces when they were younger. They've had teeth taken out and their mouth has got smaller. So there's less room for their tongue, so there's more stress at night. So there's some common things that I see that we can help with all of those things, just to try and reduce the stress on the body, improve the gum health, reduce inflammation, and take that dental factor out of the equation so they can focus on all the other aspects.
So when you said before about the teeth decay sort of on the inside, the inside of the neck of the tooth, is that Do you think because the tongue's enlarged, or what do you? What I should ask you?
No,
Why do you
look,
think that is?
I mean, there's certain aspects going back to the adrenal stress as well, the adrenal and thyroid stress. There have been some studies with rats, unfortunately, but it showed that when you stress something, they're more prone to a system in the body. Each tooth in the body has a little nerve and blood supply inside the tooth, and then it's covered by the dentine and then the protective shell of enamel. Now, there's a pump system that pumps fluid from the inside of the teeth to the outside of the teeth, and it's controlled by the HPA axis, which is your hypothalamus pituitary adrenal axis, which is your stress zone. So if that's working fine, then there's a pump system that pumps fluid from the inside to the outside. But if it's not fine, it can reverse. So all of a sudden, if you've got small amounts of plaque that are the nasty bacteria or full of the challenging Streptococcus mutans, and then they're going to get sucked into the tooth. So that's where maintenance of oral hygiene is so important, because the inside of the mouth is often full of saliva, and the saliva should be washing everything away. So it's the area where there's least risk of decay. So it's always, when I see these sometimes little cavities in that area, I then start asking about thyroid health and start asking, what are you sleeping like, and stress, really. That's and I must admit, over the last 3 years, we've seen it more and more because people are just, are beside themselves with stress.
Yeah. So you're seeing more of that stress response in the mouth.
Absolutely. Yeah.
And
people
more thyroid patients?
For a long time, and all of a sudden things are starting to go wrong.
Builds up, doesn't it?
Yeah.
Yeah. I suppose, when I would say most people who go to their dentist aren't expecting their dentist to talk to them about stress and sleep. So that, I suppose that's part of what sets holistic dentistry apart.
I actually think breathing and sleep are the keys to good dental health in as far as gum health. And I mean, if your child is getting tooth decay, it's a lot. I mean, obviously diet is one thing, but sleep and breathing is massive. If your child can't breathe through their nose because they may have adenoids or tonsils, or then they're going to mouth breathe, and then they're going to turn their nervous system on, and then the defensive mechanisms of their saliva is going to reduce, and with carbohydrates, and the risk of tooth decay is higher. But that's another story.
So actually, can I ask about the mouth breathing? Because one of the things that I've seen a bit of is, to prevent mouth breathing, about mouth taping. What are your thoughts about that?
Mouth taping, the purpose of it is really to try and eliminate the mouth breathing. But if you are a mouth breather, there's often a reason. You've either damaged your nose, maybe playing footy or, whatever, or you've got sinus issues and maybe some congestion in the sinus, and there's a lot of congestion in your nose, or you have tonsil issues, or you've had orthodontics where your bite has been made smaller, so your tongue is in a smaller space, so it gets pushed backwards. So it's actually difficult for you to breathe through your nose and then breathe into your lungs. So if everyone's encouraged to put tape on their lips, some people are going to be under a lot of stress, and there's a system between the respiratory system and the heart, and that's going to get under a lot of stress. So it can be detrimental for some people. But if you get assessed to make sure your nasal passage is working well, and that's why we work with ENTs, ear, nose, and throat specialists, if that anatomy and the structure's there, and we can show by putting your jaw in a certain position that your tongue is moved away from the back of your airway, then you can breathe through your nose. And that's often by making some sort of splint or something that holds your jaw forward, then taping your lips. But I would say being vertical, taping your lips would be a good idea, because you know that you've got that passage of your ability to breathe up through your nose and then just breathe through your nose. Because when you breathe through your nose, and when you breathe properly through your nose, you fill the 4 chambers of your lungs. But when you mouth breathe, it's very hard to fill them. So you're under breathing. You're over breathing with the mouth, but your lungs aren't filling as much.
Yeah, that's really interesting. So when someone comes to see you and they've got sleep issues, or you send them off to an ENT to check that physiologically that they can breathe.
We use the camera to look down, look beyond the tongue to make sure there's no tonsils or adenoids adenoids you can't see, but tonsils you can see. But looking to see if they've, if when they bite together, can they breathe through their nose? I mean, there's a simple little test that I call the pencil test, which everyone can do. And I've got a pen here now, but if you bite together and bring your lips together and just breathe through your nose and just feel how much you can fill your lungs up when you breathe through your nose. Now, if you were to get a pen or a pencil,
I'll do it with you.
Yeah, and put it between your teeth and then seal your lips around it. And now breathe through your nose. You should find maybe the pen's a bit big. It might be a pencil, might be better. But you should feel that your nasal, the resistance up in your nose down into your lungs is less. So there's a thing called upper airways resistance syndrome, which is basically, I can't breathe through my nose properly, so I'm going to revert to mouth breathing. But when I'm reverting to mouth breathing, I tend to lean my head forward to open my airway, and then you get neck pain and shoulder pain because you're holding, this head is 6 kilograms when it's on your shoulders, but when it's forward like this, it's 12 kilograms, and all these muscles are overworking. So just by doing that simple test, if you find that you can breathe through your nose better, then it may be an idea to see a dentist to see if maybe even the little splint to put between your teeth or a mouth guard or just opens up the bite, protects your teeth, because then you're probably a clencher and a grinder anyway, and just allows you to breathe better through your nose. So they're things that need assessment.
Yeah, well, and they're things that the average listener probably has never thought of. And I know, I mean, I came to see you as a patient a few years ago because I just wanted that. I wanted an overview, like a holistic overview.
Yeah.
And that was one of the things that you gave me was a mouth guard. And I've had that replaced a few times. A couple of dogs have got to them.
They do like them.
Had to come back in a couple, for remolding. But that made a very big difference to my neck and shoulder tension. So I still sleep with that.
Yeah.
And I was surprised. It really, I mean, I wasn't expecting that, but it really has made a big difference in the last few years that my neck and shoulders I don't have as many issues with them. So that's been really helpful.
Well, your jaw it just swings forwards and back. Obviously, when you chew, it goes from side to side, but it's just one bone. And when if you've had teeth taken out and braces, and then the arch of your upper jaw is smaller, then your lower jaw, the teeth in that becomes smaller, and your bite becomes tighter. So it's a lot tighter, so that your jaw joint is pressed up into your skull more. By making the little guard, I mean, that's just a simple little soft guard. And all we're doing is we're just taking the stress away. It's just moving the whole jaw 2 millimeters or 3 millimeters away from there. But also it just allows that resistance at the back of your nose to be relieved so that you can breathe through it. So we're taking the stress away from here, and here, and improving the nasal airway. Again, that just improves deep sleep so that you get less adrenal stress. And then if you have a thyroid issue, then obviously you're going to wake up more refreshed and more energetic for the day.
Yeah. And I wonder, like you said at the beginning, a lot of your thyroid patients have had significant stress or, maybe perhaps don't manage stress particularly well. And so that whole tension, clenching, tightness, I imagine, is reasonably common. Like,
Yeah, well, look, you've got to wonder what came first, because if
mm,
there's, again, this is where dentistry, if the impact of dentistry where your bite is really locked or very overclosed, and you've been going through life not being able to breathe through your nose, and struggling with all head and neck stress, then your cortisol levels will be constantly high as well, which then
mm,
play a part in disturbed sleep,
yeah.
effects on the gut health, effects on everything, which then plays a part in on the adrenal stress and the thyroid issues that come with it. Then, so this is where I did a podcast with a chiropractor just recently about the development of the fetus and development of the head, the jaw, and even in the womb, it has an impact on the development. But then afterwards, elimination of certain foods that affect creating tonsil issues or glandular tissue issues, which then make it difficult to breathe through your nose. So you create a mouth breathing, which creates the crowding, which then leads to the orthodontics, so then leads to
Oh,
the
right. Wow.
right, which then leads to the stress that then leads, so it all sort of is in a cycle. So the earlier
Mm,
we can make an impact to prevent that, the better.
yeah. Well, when I think about children, I remember reading an article a couple of years ago about. Oh, it might have just even been an Instagram post, but I follow a couple of the holistic dentists in the States, and I'm sure it was one of them that said that it's that whole, because with Hashimoto's, hypothyroidism, everything's slow. That whole, if you're a slow teether, like slow at getting your teeth, slow at losing your teeth as a
Yeah.
kid, that can be a sign of hypothyroidism. Is that?
Okay.
Do you see that? Or is
Look,
that too long a bow to draw?
look. I mean, I'm not sure about that. I mean, certainly
Hmm.
delayed loss of baby teeth.
Hmm.
There is a big variation,
Hmm.
um, but I'm
So
not too
maybe it's not.
sure
Yeah.
of that being the effect of the
Yeah.
reason.
Yeah. No, I think I tuned into it because I was always I was slow to lose all of my baby teeth. So I think, oh, though maybe that, I think it's that confirmation effect. Maybe I thought, maybe that could have explained why I was a slow at losing my teeth, or they seem to take forever to regrow the adult teeth. But um, yeah,
Look, I mean,
maybe not.
again, development is everything for not only the teeth themselves, but the function of the expansion of the upper jaw, so that
Mm,
it optimizes the position of your tongue, so that you can breathe better. Because the ideal breathing is with your tongue up in the roof of your mouth,
mm,
in a nice broad jaw, so you can breathe easily through your nose. So I mean, part of the reason why kids suck their thumb or suck their fingers is because they figured out that when they do that, everything sucks in and they can breathe better through their nose, so they can calm the
ah,
whole system. Whereas
ah,
if you can't do that, then you're in this stress mode, the fight or flight, sympathetic dominant, which then obviously that's when, the thyroid takes a hammering later on.
interesting. So for the, I suppose most people that listen to this podcast obviously have a thyroid condition. Most have hypothyroidism or Hashimoto's. Not all. There are
Mhm.
a number that have hyperthyroidism as
Yeah.
well. If, Actually, I'm going to ask a different question. Are there particular issues for overactive thyroid and oral care? And then I'll come back to the other question I was going to ask.
Like Graves' disease. And
Yeah, like Graves'
yeah.
disease. Like, do you see different things with
Look,
them?
I mean, we've had some patients were diagnosed with Graves' disease, and then they went into hypothyroidism.
Mm, yeah,
So they're sort of bouncing up and down.
yeah,
Um, Graves' disease is that we don't see as much, certainly.
yeah.
And it's not something that we really try and intercept as much,
Hmm.
as far as reduce. I mean, in everyone, reducing the stress, improving breathing, improving sleep, eliminating inflammation in the mouth, addressing any infections that are in the mouth as well. That's another factor that we'll talk about. Um, and just optimizing their nutrition so that they
Mm,
can they can optimize their gut health, they can optimize their oral health.
Yeah.
So as far as the hyperthyroid, we don't see many.
Okay.
And it's just a basic of eliminating those aspects, and with a positive effect in each.
Yeah, yeah, and look, often what I've found talking to people across the thyroid spectrum is that the diet and lifestyle interventions apply pretty much across the board.
Yeah, yeah,
So that the treatment, the medical treatment differs significantly, but all the diet and lifestyle interventions are pretty much the same. So that sort of fits in with what you were saying.
yeah.
I'll come back to all the nutrition because I think that is really, I want to dive into that. But if someone's listening and, they can't access a holistic dentist, or that, I mean, obviously you can go looking for one, but there's, like you said, not many around. What should, are there particular questions they should ask their regular dentist to be looking for, or like how should they deal with their regular dentist?
Well, they're risk factors for tooth decay and gum disease. Any traditional dentist should look at those aspects. They may be promoting more on the traditional chlorhexidine and fluoride proposal, which for somebody who is hypothyroid and their body needs iodine, and iodine's the only halogen that the body needs. It doesn't need chlorine, it doesn't need bromine, and it probably doesn't need fluorine either. But iodine is the key, really, and the fluorine will displace the iodine. So I would be avoiding fluoride toothpaste and finding an alternative toothpaste, but one that's got hydroxyapatite in it, which is basically the minerals that repair the teeth, the calcium phosphate minerals. So looking at the airway, a lot of dentists are looking at airways now and looking at sleep. So potentially asking your dentist about, do you assess airways as well? Can you see if my bite is having an effect on my sleep or having an effect on my breathing, especially through my nose? And they can certainly, and if somebody has got signs of clenching, and dentists are used to dealing with people saying, oh, you grind your teeth or you clench, let's make you a splint or a mouth guard. Now, that in effect is protecting the teeth and also stopping you from grinding on any potential mercury fillings that maybe you can't get replaced, or maybe don't want a traditional dentist to replace them because there's going to be more exposure if there's a safe way of doing it. So getting some sort of mouth guard that inadvertently will improve the breathing as well. So that a traditional dentist would certainly be able to do that. So you could even ask, could you make me a splint that actually protects my teeth? And whether the dentist looks at breathing or not, it's going to help your breathing as well.
Yeah, so they'll be looking at it from a different perspective, but it's still going to give you that broader help.
Yeah.
Okay, that's good.
And what else? The pH of your saliva. That's a really simple little test that, we're looking at saliva, maybe with a hygienist, make sure that the dentist has got a hygienist, because a hygienist is focused on the biofilm, the microbiome in the mouth. We're looking more and more about, not talking about dirty teeth. We're talking about the bacteria in the balance in the saliva in the mouth and in between the teeth. And there are hygienists' job is to actually maintain that, really, and show you how to try and maintain it. But there's some simple things that we can suggest. But in answer to that question, I think they're seeing a hygienist and focusing on oral health as well, on the maintenance.
Okay. And well, why don't we just follow while we're on that? Follow on. I mean, I think you recommend oil pulling. I think I remember that from last time. It makes me gag. I can't do it, but I've tried. So tell us about, what do you recommend for that oral health?
Look, the concept of oil pulling is a traditional Ayurvedic with sesame oil.
Oh, sesame oil. Okay.
The Ayurvedic says that it pulls all the toxins out of your body, or it gets your bodies rid of toxins. Now, I'm not 100% convinced on that. I recommend coconut oil, mainly because it has antibacterial, antifungal, and antiparasitic properties. And just a flat teaspoon on the internet, they say tablespoon, and it's way too much and it'll make you gag. But if you just have a flat teaspoon of coconut oil, whether it be in the winter when it's like white lard, as soon as it hits your mouth at about 23 degrees, it will go into a very low viscosity liquid very, very quickly. And if you keep your lips together and you draw it in and out between your teeth, if you have gum problems, then you've probably lost a little bit of support around your teeth. So you've got bigger gaps between your teeth, which are harder to maintain. Well, that oil is going to go in between with a little bit of force in between all of the nooks and crannies in between your teeth, around under the gum. If you've got a partially erupted wisdom tooth that's flaring up, it will draw any infection out from that, and it will just change the daily flora of the bacteria that's sitting in your mouth. Now, there's been more and more evidence that it's the bacteria, the gram-negative bacteria that are in your gums and at the end of a root canal or a wisdom tooth or their bacteria are releasing these toxins that are breaking down the tissues and causing inflammation. So if you can get control every day of actually changing that biofilm simply by putting oil in your mouth, only for 5 minutes, then you're going to have a positive effect on the reduction of inflammation, the colonies of nasty bugs that are in your mouth, and you'll find your tissues will tighten. Your teeth may even look a little bit lighter because the stain that accumulates every day, it stops it being sticky, so it makes your teeth lighter. But the most important thing is if you do oil pulling, and that's for 10, 15, 20 minutes, is actually this. Because you've got your lips together and you're oil pulling, you're breathing through your nose. So when you're breathing through your nose for 20 minutes, you're calming and stimulating the vagus nerve and the parasympathetic, the healing, stimulating your digestion to start working, your detox pathways to work. So your respiratory system to calm, your blood pressure to reduce. So all of these things, when you've had a stressful night and you wake up, you're exhausted, you've had a bad sleep, and then you've got to go again, you've got the day ahead, and again, most of my patients who have got thyroid issues, they're mothers, they've also got jobs, maybe 2 jobs, and they're doing sport and with their kids, and so they're all over the place. So it's just, they just have to go. Well, that oil pulling will just, it will just allow things to calm a little bit so that it gets you ready for the day. And then you spit out into a tissue and throw in the bin. So in a way, the oil pulling I talk about, in a way, does detox the body and does have a positive effect. But it's not the oil that's doing it. It's the breathing through your nose that's doing it. So the first 5 minutes for your mouth, the rest is for your whole body.
Yep, I can see that. So give it a go. Maybe I'll have to try again. I've tried.
In effect, if you do it with water, you're not getting the antibacterial, but again, you're keeping your lips together and you're doing it for 20 minutes. So it's the purpose of breathing through your nose is so powerful. And then you're not mouth breathing as well. So it's often the mouth breathers who get most benefit from oil pulling, because if you've been mouth breathing all night, your blood pressure's up, your cortisol levels are up, your stress is up, your digestion is not working. It just stops working because everything else, the sympathetic fight or flight has been set in action. So if you can turn that around, it has a powerful effect. And that's where the patient or the people who have a thyroid and adrenal stress, it's only going to be positive for them, and it doesn't cost anything.
Yeah, that's good. Yeah, I hadn't thought about doing it with water. Just I might try that actually, just with water to start with. I don't think I'll gag on water. But I have a very strong gag reflex. So, David, you mentioned before mercury fillings, and do people still get mercury filling? Tell us a bit more about mercury fillings and what you can do about them if you've got them and you don't want them anymore.
Yeah, look, mercury fillings are the old silver fillings that people have had in their mouths. The dentist and the nurse mixes up, or the nurse used to mix with their fingers. I mean, in a little cloth, a combination of mercury, of 50% mercury, 30% silver, and then the combination of tin and a bit of copper and other metals that in each design is slightly different. So then that creates a mass that then is placed and compressed into a hole in the tooth, and then it sets, and then is supposed to be inert. Now, it's been shown, and even the United Nations Environmental Protection over 16 years ago, they got together and said, we've got to eliminate or try and eliminate mercury from the environment. And there were 5 parts of the elimination. Obviously, mining was one of them, but one of them was dentistry. And there were 130 countries who said that they were going to eliminate or downgrade and stop using mercury in dentistry. Now, Europe is, I think, just about to do that now. They're just at all those, they're just about to, there's 130 countries who've signed and ratified that they're going to. Europe's about to do it. Australia has agreed to down regulate rather than ban altogether. But still, in a dental school, to be a dentist, you have to learn and you have to show that you can place an amalgam filling.
Wow. I didn't realize.
And yet, and the rest of the world is, and the same probably everywhere else in England. And that's where, as a dentist, I mean, I've been working for 35 years as a dentist. So I remember when I first got introduced to natural health, I went to a chiropractor and I had a bad back in Sussex in England. And he took one look at me and he knew what I was doing. And he got a piece of amalgam and he put it on my chest and he did some muscle testing. And he said, "You're so mercury toxic, I can't help you." And I went, well, I was really annoyed because he didn't fix my back. And he walked away without even treating me. But it sort of made me look, okay, let's have some tests and see what there is. And when I got involved in the ACNEM, all of a sudden I found that I had high levels of mercury and high levels of lead as well, being brought up in Liverpool. So they were the 2 combinations that were really dangerous. So I thought, okay, I'm going to do everything I can to eliminate them and then protect me as a dentist. But also I've got to protect my patients and my staff as well. Nurses are predominantly female, so you can't be exposed to mercury and not have something positive happen, really. And again, that comes back to thyroid health but also genetic harm as well. So in America, I got my levels down, and anyone who works with me, they are in a protected environment where we have filters in the building. When we are removing a mercury filling from somebody, we use what's called the SMART protocol, which is the safe mercury amalgam removal technique, which involves nutritional support beforehand, but mainly most of my patients will see a naturopath or someone first, so they come from that. But then we isolate the tooth so nothing goes down the back of your throat with a dental dam. It's like a sheath that goes over. We put chlorella in the floor of the mouth so that it like mops up if anything does seep through the dental dam. The patient has a nose piece on, so they're breathing oxygen. They're covered head to toe with a gown. We're basically in hazmat suits with a gown, with masks, with mercury filters on that mask, so they're specific for mercury. And then with a lot of water and a lot of suction, we quickly remove the fillings as quickly as possible, and then restore the tooth as strongly and long-term as possible with something white, whether it be ceramic or a resin. But then at the end, then put more chlorella in the mouth once we've taken everything off and the patient rinses out. And so that protocol should be used and really should be taught in dental school. So if we're being taught to put them in still, we need to learn how to take them out, because if none of those protective mechanisms, not only is the patient going to get exposed, the dentist is being exposed, and the nurse is being exposed. So, in effect, that's just something we do, and we follow that protocol that's come down from America, and every dentist should really be respectful of it, I think.
How would you know if you were experiencing the negative effects of mercury?
Well, mercury is a neurotoxin, so there is no level that's not unsafe, unfortunately.
Okay.
So it can affect cardiac health, it can affect neurological health, it can affect memory, sense of smell, everything really.
If you've got mercury fillings, you are being impacted regardless.
Look, again, this comes back to the splint. This comes back if you're not sleeping well and you're clenching your teeth and you've got mercury fillings in your mouth, then you are going to be grinding on those fillings more than if they weren't there. So you're going to be getting a micro exposure, which will go into your gut microbiome, but also you'll breathe it in and it will go into the rest of your systems as well, through your lungs. And so trying, again, a guard of some sort, especially like a pregnant woman, if they've got amalgams, if they can get some sort of guard that stops them from grinding on those fillings, then they're going to markedly reduce, because it's mainly during the night that your teeth come together, markedly reduce any potential exposure.
Yep.
But if not, then if they're clenching and then they're going to be getting an exposure, which will cross the blood-brain barrier. It's crossed through breast milk. It's transferred from mother to child. So it's really it's something that, this is why United Nations Environmental Protection is sort of trying to make steps to actually change the way we think about it, and then promote just a safe way of taking responsibility. That's all right. We just need to take responsibility. Not just that, but then the wastewater. Norway, I think, has banned mercury amalgam for something like 30 years already.
Right. So they're really the forerunners.
And they did some studies on the water system, and there was high levels of mercury. And they realized in all of the waterways, the dentists were just basically, all the wastewater was going into the waterways. So they just put filters on all of the dentists, which we have in the practice. And all of a sudden the levels dropped. So they said, well, this is crazy. This is so, I mean, that may not the 100% pure story, but that's basically the gist of, by addressing the dental waste, it had a big effect on the environmental damage.
Yeah.
So it's something that, all your listeners, I think, if you're having an amalgam removal and there's no safety, then you're better off, and this is what the Dental Association says, you're better off leaving them as they are. They often say, do not have elective amalgam removal, because the exposure is going to be far more than leaving it there. Because when you drill it out, it creates a high exposure.
Right.
And again, this is where the tragedy that there's not enough dentists who use these protocols to protect the patient, protect the staff, and protect the planet.
And protect themselves.
Yeah.
Yeah. Okay. So coming back to the nutritional aspects. We talk a lot about nutrition on this podcast, and foods that are, helpful and not helpful for thyroid health. But when we're talking about oral health and thyroid health, what do you advise your patients for nutrition? What to eat or not to eat, or how do you talk about that?
If they have amalgams in their mouth, then it's important to have animal products. Unfortunately, it's important. And Weston Price was a dentist in the 1930s who showed that the communities around the world that lived off their traditional diets had beautiful jaws, beautiful airways, beautiful teeth, and then as soon as Western medicine and food came in, their jaws stopped, they got tighter and smaller, their airways got smaller, they had more problems. And it was the animal products, the fat soluble vitamins that were essential. And, getting fat soluble vitamins, the best source is animal products. If you don't have amalgams in your mouth, obviously, as far as somebody with a thyroid issue, then magnesium is one of the important things. We often find our patients who are getting headaches and neck tension and pain, then optimizing magnesium in the evening in some form, whether it be a cream or a gel or taking it orally, with a combination of minerals, in trying to address any leaky gut issues as well. That's again, that's a journey with a naturopath.
Yeah.
I've just recently heard about colostrum, how beneficial that is as well. It not only knocks out the lipopolysaccharides that are the byproduct of the nasty bugs in the mouth, that's also happening in the gut, and colostrum apparently reduces that. So
you mean not just for newborn babies? Is that what you mean?
Yeah.
Okay.
But so hydration, again, very important for oral health as far as nutrition is concerned.
And when you say hydration, you're just drinking regular water, filtered water, with anything added to it. Like what do you suggest?
The idea of getting clean water. I mean, we get water that's from a well, basically, or delivered in big bottles that is provided for our patients. We have a filter, a reverse osmosis water filter for use in the surgery, but we only use that for procedures. Reverse osmosis water, it does strip the fluoride out. But it strips everything out. So I'm not 100% convinced it's very good for the human as well, because your body needs minerals. Yep. And if it's not in the water, then it's going to take it from somewhere else. And it's the bones and teeth that are often that choice. So, so as clean a water as possible. Obviously, we've talked about the issues with the fluoride. So trying to eliminate or minimize fluoride, chloride as well. So eliminating the halogens. But then there's so much contention about water and what water you should drink. And I mean, there's some exciting aspects with ionizing water and hydrogen added water. But generally, Evian is probably one of the nicest waters I've drank. And I mean, Fiji water is a good water as well because it's a nice pH.
Okay. And does it matter whether it's carbonated, like the sparkling water, or still? Does that matter?
Look, I think drinking sparkling water all through the day, that's going to have possibly a negative effect on your mouth.
Okay.
But every now and then, I don't think it's going to. But but if you've got tap water, then I'd say certainly try to get it as clean as possible. So whether it be a traditional, an old-fashioned Brita filter, that's going to take the chlorine out. Taking fluoride out is a challenge. It is a challenge, and there's a lot of people say we should leave it in, and there's a natural calcium fluoride which is actually water insoluble. So it's you can't dissolve that in water, but that's the good one. That's
okay.
Yeah.
And what about adding things like electrolytes to your water? Do you?
Yeah, look, again, Himalayan salt, a pinch of Himalayan salt is so beneficial to everyone, really. Very good way of hydrating. But really making sure that you are hydrated is probably the advice. Try and eliminate mouth breathing, hydrate, oral hygiene, make sure that the biofilm, you address that every day. Those simple things, and then just support the body from the side effects of, whether it be thyroid, adrenal, or sport, or, pushing yourself too much, then all those things are beneficial. The the magnesium products that are out there.
Yeah. Now, I haven't heard you mention sugar, and most dentists talk about sugar. Is that just a given? We shouldn't be eating sugar.
Look, we recommend in small amounts xylitol, which is a
Okay.
natural sugar.
Mm-hmm.
Xylitol inhibits tooth decay. It
Okay.
stimulates your saliva. It has a beneficial effect on your mouth and your sinuses, and you can have nasal sprays with it as well. But I wouldn't have it in big doses because it's going to have an effect on the microbiome of your gut. So everything in moderation.
Yeah.
Again, and that I suppose that goes with all sugars, really. Just everything in moderation. The machine that we use, or the technology we use to clean and change the biofilm with our hygienist, uses a little bit of erythritol with a warm water and a spray. So it's called airflow, and it changes the biofilm under the gum. So when you see a hygienist, you might think of an uncomfortable situation where it hurts, whereas this is a painless and much more effective because it's addressing the biofilm. We're using that erythritol. So that, again, that has another natural antibacterial effect. So we tend to talk about those type of sugars rather than the elimination, because to be honest, most of our patients who come to us, and probably who are listening to this, are on a health journey, and they know that, sugar should be a minimal factor.
Yeah.
If you're going to have chocolate, dark chocolate, there's studies showing that the theobromide in dark chocolate has a positive effect on the mineralization in the teeth. So I'm a fan of dark chocolate.
Yeah.
So
Yeah, you're probably right. The patients that come to you, just like the people that would listen to this, are not the ones that are drinking Coca-Cola all day and living on McDonald's. That's just not our demographic.
And even the likes of Coke, obviously the acidity is the effect. I mean, a lot of patients again waking up, their digestion's not working. They've got a dry mouth because they've been mouth breathing, and then they use lemon water or apple cider vinegar. Now, that can have a positive effect on the digestive system, but the biofilm that's around the teeth it struggles to cope with that acidity. Your saliva itself will buffer it into a very alkaline environment, but if it gets around the neck of the teeth and under the gum, and it's 10,000 times more acidic than your natural saliva, then you can start getting problems. And we see a lot of people who have used lemon water for a long time and they've lost 70% of their enamel because then they brush their teeth afterwards and their enamel has literally disappeared because of the acid slurry. So, so using a straw in those sort of situations, or trying oil pulling, because oil pulling is going to do the same benefit of getting your digestion working, which is often the reason why people do it in the first place.
Yeah, that's true. Yeah, exactly. Well, wow, I think we've covered a whole lot of, a lot of information in in a fairly short period of time. David, is there something I haven't asked you that you think the audience would need to know or benefit from knowing in this
Look,
context?
I mean, we haven't talked about infections and the issue of having an infection and challenging a system, and making sure that you get all of your teeth checked so that you don't have infections in your mouth. I mean, we have a cone beam CT, which is, again, we protect your thyroid, but it is a machine and it does emit a radiation, but it gives us a three-dimensional picture of all of your teeth, the roots of your teeth, because if you've got an underlying low-grade infection, then that could be one of the factors that's challenging your health. And I think we address those issues with infections, but we use metal-free zirconia implants as a solution for them as well. So there is a way of actually addressing the problem and not having to put metal back in your mouth, because ideally having a metal-free mouth would be ideal for any patient, well, anyone really, but certainly eliminating metal would be a smart move.
Okay. And is there anything else you wanted to say about the infections, or how it's just that
Oh, look,
they're
it's
looking
just,
for them?
the bacteria that's associated can release a lot of endotoxins that's been linked to a lot of gut issues, health
Mm-hmm.
issues, and just to make sure it's not in your mouth,
Yeah.
really.
Well, infections can trigger Hashimoto's in the first place. I mean,
Yeah,
that's one of the
yeah,
common triggers as different infections.
yeah.
So,
And
yeah.
it's often the patients who may be in that stress mode already,
Mm-hmm.
and then they might have either a failed root canal or an infection, a gum infection, that then the health goes downhill
Mm-hmm.
because it just tips them over the edge. And we
Yeah.
do find that a lot of patients who are coming in with an infected root canal, they have already before that had that stress, high sympathetic tone, stress
Mm-hmm.
mode already. And it's just, and once we eliminate that, but then optimize the airway and breathing and sleep and the inflammation, then they're on the right journey.
Yeah. Yeah. It's so many conversations I have on this show come back to stress, that really uh, such a significant impact on every aspect of our health.
Yeah, yeah,
Yeah. Yeah. And
yeah.
as you say, we're living in a stress world. So we've got to learn, I'm a firm believer we have to learn how to manage our stress. If we're not doing that, then we're just going to end up in a big unhealthy mess.
Well, yeah, I mean, there's other stresses. There's EMFs and all of those aspects as well, and
Mm-hmm.
that's another reason not to have metals in your head.
Uh-huh.
So,
Yeah. Yeah. So I think just take action with what you can do, one thing at a time.
yeah, look, getting a toothpaste with the hydroxyapatite would be a really good thing.
Yeah, I've just
The
heard about
oil,
that just in the last week or two, actually. So is that
yeah,
a new thing, or is it just been around and I haven't heard the term?
there's been a few. I mean, for the last probably 5 years, there's been some products that with it in,
Mm-hmm.
and then some using probiotics as well. So,
Hmm.
like Lactobacillus salivarius and Streptococcus salivarius, and all
Hmm.
influenced to try and influence the biofilm in the mouth, which is exciting. It's
Yeah,
exciting
that's
that we're
great.
looking at that. I mean, people talk about taking probiotics for the gut health,
Mm-hmm.
and now we're talking about, well, here's the source of apparently 23% of all the bacteria in the gut is residing in your mouth.
Wow.
So, it has a big influence. So
Just even, yeah.
trying,
So I was just what you said right at the beginning was, your mouth is part of your gut, and I mean that in and of it. When if you can get your head around that, and because I think a lot
yeah,
of the people that listen to this show know how important gut health is, but when you realise then that your mouth is really part of your digestive system, that sort of puts a whole different perspective on it.
yeah, yeah.
Yeah.
And if you want to treat the leaky gut, you've got to treat the mouth.
Yeah.
You've got to address the mouth.
Okay. So are there any particular brands of toothpaste that you do recommend or not?
Oh, look, we're recommending a product called GEM,
Okay.
which is it's a very well packaged, and it tastes nice. It doesn't taste like a natural toothpaste,
Okay. Yeah.
which it has a good range. It has 6 different flavors. There's actually one with fluoride in it as well. So if you wanted to have a fluoride toothpaste, you go. But it has Lactobacillus salivarius. It's got the hydroxyapatite. But then there's Mugu do
Oh,
toothpaste
do
as well,
they?
which again they have
Yeah.
a hydroxyapatite in that as well, which is a very bicarb based one. So it has a very bicarb
Ah,
taste,
okay. Now, have you
which is
heard of
fine if you're getting acidic environment. If you've got reflux and your mouth's getting assaulted every night
mm-hmm.
and every day from the acid, then a bicarb based toothpaste would be a really good idea.
Okay. Have you heard of Archie toothpaste?
Vaguely,
Yeah, I
vaguely,
can't remember how I came across it. Could have been a social media ad, but one of my kids just doesn't like mint flavored toothpaste, and I was trying to look for a natural toothpaste that wasn't mint, and somehow came across this that comes in all sorts of weird flavors. But I was just rebuying some for him the other day, and it mentioned the hydroxyacetate.
yeah,
And they've sort of got some that have fluoride, some that don't, some that have this hydroxyacetate. That's how I first came across it just last week. So,
yeah,
uh,
yeah.
yeah. So I don't think I don't remember seeing anything about any of the
Look, I heard
probiotics.
a term that was used in the English marketing of it, calling it crushed bones,
Oh,
which it was, uh, which it isn't. It isn't crushed
right.
bones, but
Okay. Yeah.
that's, it sells the concept that it's actually the constitution of bones and teeth, and you're putting it in a toothpaste that actually has an impact
Yeah.
um, of, of beneficial. If you've got early signs of decay, it can actually remineralize. But if that decay's got beyond the enamel, the outer shell, then it won't reverse it. It won't.
Okay.
It's very
Okay. Well,
difficult.
that's a good thing. Keep an eye out if you're listening for those sort
Yeah,
of different toothpastes.
yeah.
So, well,
I mean,
thank
I
you,
thought
Dave.
about
Yeah.
making my own toothpaste, but it's
Uh-huh.
just, but it would be a food grade toothpaste, really,
Hmm.
because it's just too hard with the TGA, and
Oh, I'm with you. Yeah.
it's too expensive and too hard.
Yeah.
So there's some good products out there.
Yeah. Yeah. And I think that's where it's helpful to know, isn't it? Just even switching your toothpaste and drinking better water. Like, I mean, they're
Yeah.
two simple things. And then, if people, well, for those listeners that are here in Brisbane, tell people where they can come see you. Tell people
Yeah,
how they
look, we're
connect.
we're in the Gap in West Brisbane, and the practice is called Dental Wellness, and the website's dentalwellness.com.au. It's very very easy, and we see patients from all over Queensland and beyond, really. So
Mm.
a lot of patients travel. Again, unfortunately, because there are very few dentists who look at the whole body. But then, it's saying that the dental industry, the ADA, have just finished a dental week where they're promoting the fact that it's all connected. So
Oh, well,
it
that's
is
good.
it is things are changing. So that's good.
Slowly but surely.
Yeah.
Slowly but surely. Well, thank you so much for your time, David. I really do appreciate it, and all that 35 years of knowledge and experience. We've probably just touched the surface, but I think people will have found this a really practical and helpful conversation. And yeah, certainly if you're local, go see David. And if you're not, use the tips here to go,
Yeah.
get
Yeah.
better value out of the dentist that you're already seeing.
Yeah. Look, I'm fortunate. I found a profession that the way that I have moved to the wellness industry has made me passionate about it still. So even after 35 years, so I feel I'm blessed to be in a profession where I can make a difference.
Yeah, yeah, yeah. Well, you definitely can, and you are. So thank you for all that you do. All right, this is our little KISS thyroid coaching segment at the end, which we've been doing for quite some time now, most of this year, I think, or at least the last 6 months. The idea is that I'm just going to ask you a couple of questions just to help you to think about what you've just listened to. And most importantly, think about how you can apply some of what you've just heard. So, the conversation has all been about oral health, the connection in between your gut health, brain health, thyroid health. So, first of all, is there something that just stood out from the conversation that you need to investigate? Because I think that's often the most important thing you can take away from a conversation. It's usually just one thing. So if that one thing has already stood out to you, then jot it down, make a little audio voice recorder if you're out walking the dog. But just you want to remember what that one thing is. Now, I suppose the second thing is if there's not that one thing, like have a think about, do you need to go back and listen to those questions to ask your own regular dentist? Do you have trouble with nose breathing and sleep? Like, is that something that you need to investigate further? Do you need to go look for a new toothpaste and new water? So I think there's lots of things that came out of this conversation. There probably are quite a few other questions, but let's leave it at that. Because I think they're the practical things that some of the immediately practical things that you can do as a result of this conversation. So, Pardon me. Well, thank you very much for listening. Really always value having people that listen to these conversations, and I trust that this one was helpful for you, and look forward to bringing the next one to you in a fortnight. See you later. Bye. Thank you so much for listening to this episode of Let's Talk Thyroid. If you have enjoyed the content, or perhaps you're thinking, oh, my mum needs to hear this, or my sister, or my bestie, I would love it if you would share this episode with them. That really just helps spread the positive and practical message of Let's Talk Thyroid, and helps that broader thyroid community, our friends and family, to live well with their thyroid health. So you can just, share the episode. If you subscribe on whatever platform you're listening to this podcast, it's free. It's really helpful because then you'll be notified every time a new podcast comes out, and it just makes it much easier to find. There's usually a little subscribe button or a bell, or follow often is the terminology. So if you wouldn't mind doing that, that would be helpful. Of course, if you want to leave a review, even better, just a sentence or two about how the podcast has helped you. You can definitely connect with me via letstalkthyroid.com. That's where you'll find access to my book, my coaching, my freebies, and really everything that I offer in terms of thyroid support.